The University of Texas Health Professions Office proudly presents Which Health Profession Best Fits You? Many students realize that they are interested in pursuing some type of healthcare career, but many have difficulties deciding which track suits their personalities and meets their goals. It is important to note that all health professions tracks represent a long-term commitment and require hard work, leadership, diligence, dedication, and responsibility. Before we go into more detail, here are some prominent pre-health professions pathways in which you may be interested in pursuing. Pre-medical, pre-dental, pre-physician assistant, pre-pharmacy, pre-occupational therapy, pre-physical therapy, pre-optometry, pre-podiatry, and pre-veterinary. Throughout our discussion of all these pathways, we will include a case study wherein we observe how these various healthcare professionals might collaborate in the treatment of a patient with Parkinson's disease. Parkinson's disease is a chronic progressive disorder of the nervous system that has a debilitating effect on movement. It belongs to a group of conditions called motor system disorders, which is caused by a loss of dopamine-producing brain cells. While there is no cure for Parkinson's, proper diagnosis and treatments from a variety of healthcare professionals can help relieve symptoms and slow the progression of the disease. Let's explore the different pathways together, starting with pre-med. Physicians diagnose and treat diseases or injuries. Their general responsibilities include performing patient examinations, taking medical histories, prescribing medications, ordering and interpreting diagnostic tests, and providing follow-up care. Usual work environments for physicians are hospitals and public or private clinics. This pathway requires 4 years of undergrad, 4 years of medical school, and 3 to 8 years of specialty training. An internist or family practice physician may recognize the patient's irregular symptoms and refer them to specialists like neurologists, ophthalmologists, and more. The specialist will provide the appropriate tests and examinations to diagnose the patient with PD, prescribe the appropriate medications, monitor the response to therapy, potentially perform necessary surgical procedures, make recommendations for care, and oversee the progression of the case. Repeated visits to both primary care providers and specialists can allow these physicians to constantly reevaluate the patient's condition and help the patient maintain proper health, comfort, and autonomy. Dentists diagnose and treat diseases or injuries to the teeth and gums and provide care to maintain proper oral health. Their general responsibilities include completing patient examinations, providing routine dental maintenance, performing dental procedures and administering anesthetics, prescribing medications, implementing dental appliances, and teaching patients about maintaining proper teeth and gum care. Common work environments for dentists are private practices. This pathway requires 4 years of undergraduate, 4 years of dental school, and optional 1 to 2 years of specialty training. Due to poor motor function, nearly half of all people with PD have difficulty with their daily oral hygiene regimen. The tremors associated with PD often make brushing teeth or cleaning dentures a challenge. Because PD leads to decreased chewing and swallowing abilities, patients have a tendency to avoid nutrient-rich foods, like vegetables, which require the ability to chew well. Dentists can refer the patient to special dental utensils for home dental care, recommend measures like prescription strength fluoride gel treatments, and monitor the patient's dental needs closely to help ensure proper care. Physician assistants practice medicine on a team under physician supervision, so their duties are often very similar to that of the physicians with whom they work. Their responsibilities include performing patient examinations, reviewing medical histories, ordering and interpreting diagnostic tests, providing treatment, recording patient progress, and educating patients and providing follow-up care. Common work environments for PAs are hospitals and public or private clinics. This pathway requires 4 years of undergraduate, 2 to 3 years of a PA graduate program, and additional optional specialty training. Physician assistants can work alongside their associated physicians, both general care and specialists, to help examine the patient for symptoms of PD, order and interpret diagnostic tests, listen to patient concerns, plan a treatment regimen, and record patient progress. Pharmacists allocate prescriptions to patients and provide expertise in the safe and effective usage of medications. Their responsibilities include filling prescriptions and verifying physician instructions, ensuring that the given prescription is compatible with the other medications being taken, advising patients on general health topics, giving flu shots and vaccinations, mediating with insurance companies, and overseeing pharmacy techs and interns. Common work environments for pharmacists are drugstores, hospitals, clinics, and research facilities. This pathway generally takes 2 to 3 years of undergraduate, 4 years of pharmacy school, and 1 to 2 years optional residency training. Pharmacists can prescribe medications like L-Dopa and carbidopa to slow the progress of Parkinson's disease by restoring dopamine levels. This can help the patient maintain autonomy and comfort. Pharmacists will work closely with the patient's primary care physicians and neurologist specialists to ensure that the proper medications are being prescribed in the correct dosage with minimal side effects, and with avoidance of drug interactions with other medications the patient may be using. Occupational therapists help patients who are injured, ill, or disabled to work on the skills necessary to carry out daily activities. Their responsibilities include observing patients completing tasks and developing a treatment plan to improve their skills, demonstrating exercises for the patient, reviewing medical history, evaluating a patient's home and/or workspace, and recommending improvements to accommodate the patient's needs, directing usage of special equipment and educating patients on usage, and assessing patients' activity and progress. Common work environments for OTs are hospitals, private offices and clinics, nursing care facilities, and home health services. This pathway requires 4 years of undergraduate and a 2 to 3 year master program. As the patient's condition progresses, daily activities like dressing oneself, eating, writing, and fulfilling workplace responsibilities can become very difficult. Occupational therapists can help modify or adapt these activities according to the patient's needs in order to ensure high performance, safety, and independence. Physical therapists help patients with injuries or chronic illness to improve their movement and manage their pain. Their responsibilities include diagnosing patients' irregular movements through observation and listening, reviewing medical history and notes from physicians, setting up a plan for the patient, using exercise, maneuvers, and equipment to improve patient mobility and diminish pain, and educate patients through the recovery process. Common work environments for PTs are clinics, private offices, nursing homes, and home health care environments. This pathway requires 4 years of undergraduate and a 3-year PT graduate program. Physical therapists can help treat the mobility problems associated with PD, such as flexibility, strength, balance, posture, and walking. They can design exercises or provide training to meet the patient's needs. A PT can also help family caregivers by teaching safe and effective ways to provide assistance. Optometrists examine the eye and help treat visual impairments, injury, and disease. Their responsibilities include performing vision tests and interpreting results, diagnosing vision problems, prescribing corrective glasses, contact lenses, and prescriptions, evaluating patients for presence of some diseases, providing pre-op and post-op care for patients undergoing eye surgery, and educating patients on proper eye health. Common work environments for optometrists are private offices, clinics, and health wellness stores. This pathway requires 4 years of undergrad, 4 years of optometry school, and an optional 1-year residency for specialty training. PD is often associated with vision disorders like slowed eye movement and microtremors, which can lead to double vision and trouble reading. Parkinson's can also cause loss of voluntary control of the lids, leading to spasms or excessive blinking. Due to these lid issues, patients also routinely experience dry eyes. Optometrists can help provide corrective measures for these vision issues, prescribe proper medications to alleviate symptoms, educate patients on proper eye care, and continually evaluate patient progress and needs. Podiatrists provide medical care for patients with foot, ankle, and lower leg problems. Their responsibilities include evaluating conditions of patients through examination and review of medical history, addressing concerns of patients regarding mobility, pain, and discomfort, diagnosing medical conditions, prescribing medications, providing treatment for conditions such as orthotics, providing foot and ankle surgeries, and giving advice on foot and ankle care. Common work environments include private offices, clinics, hospitals, and outpatient care centers. This pathway requires 4 years of undergraduate, 4 years of podiatry school, and a 3-year medical and surgical residency. The effects of Parkinson's can cause issues with gait, walking, and posture, which require patients to seek treatment for their feet, ankles, and lower legs. Podiatrists help provide care for classic PD issues like dystonia, toe curling, and abnormal muscle contraction, or for more regular issues like bunions, which are common in the regular population but are especially detrimental to PD patients. Veterinarians provide preventative and diagnostic medical care to animals and work on improving public health. Their responsibilities include examining animals for potential health problems, diagnosing and treating medical conditions, performing surgical procedures, testing for and vaccinating animals against disease, prescribing medication, and educating animal owners on general care and treatment. Common work environments include pet hospitals, private clinics and offices, and laboratories. This pathway requires 4 years of undergraduate, 4 years of vet school, and an optional 1-year internship for specialty training. Animals can also develop Parkinson's disease. In the treatment of an animal with PD or other serious condition, a veterinarian can assume the role of all the various health professionals we just mentioned. From examining their animal patient's medical history, to diagnosing the condition, to prescribing medication, to performing surgery, to providing vaccines, and to assisting the animal in recovering its normal activities, vets do it all. Now you've just seen a brief overview of each profession. How do you decide? Step 1. Self-reflection. When considering the various professions, think about your own personality and experiences that may inspire you to engage in certain types of work. Evaluate your talents and skill sets and how you can best apply them to help others in a healthcare career. Consider your desired lifestyle. How many years are you willing to spend in school? How many hours a week would you like to work? Are you comfortable with having regular on-call hours? In which type of work environment would you be most comfortable? Step 2. Utilize online resources and conduct your own research. There are many ways for you to discover more information about each pathway that might help guide you towards a decision. The Health Professions Office website offers some insight for students trying to deliberate amongst the various healthcare careers. Under the new Pre-Health Longhorns tab on the left-hand side, you can access Discover Health Careers. This page lists many free online services to help you learn more about your different options, including Explore Health Careers. This site provides descriptions, job outlooks, and statistics for the various health professions. My Next Move. This site allows you to browse the tasks, skills, and salary information for many different jobs within the health and counseling industry. You can also use the Interest Profiler, which offers personalized career suggestions based on the person's interests and level of work experience. The Occupational Outlook Handbook, provided by the Bureau of Labor Statistics, offers wonderfully detailed information about every aspect of each healthcare career, complete with up-to-date national statistics collected within recent years. You can find everything from job outlook to responsibilities to work environment to educational requirements. Exploring these options and weighing the pros and cons of each position is tremendously helpful in discovering your desired occupation. Step 3. Hands-on observation. Now that you've done the research, get direct exposure to some fields you're considering. You can contact some health professionals in your fields of interest and ask to conduct an informational interview. You can ask them questions like, what was their main motivation for choosing this career path? What is their everyday job experience like? And how do they find their work personally fulfilling? You can also try to find shadowing opportunities with healthcare professionals to gain first-hand experience of their daily activities and duties. Volunteering in several different areas of healthcare allows you to immerse yourself in the various fields and is a great way to inform your decision-making process. You can meet with a health professions coach at any step along the way. Coaches are very knowledgeable about the demands and benefits of the various pathways and can meet with students to guide their personal reflections, discuss options, consider the factors that may play a role, answer any further questions, and help students choose the health professions pathway that fulfills their career goals. Good luck on your decision making. Contact the health professions office to make an appointment.